Hi everyone, I am Dr. Abdul Tawfiq from SNS College of Physiotherapy, Coimbatore. Today we will discuss a crucial condition under the musculoskeletal and rheumatological disorder ankylosing spondylosis, focusing on especially on its clinical features and the role of physiotherapy in particularly in ankylosing spondylosis. Let's start. First, ankylosing spondylosis is a chronic progressive inflammatory disease that primarily affects axial skeleton. It comes under the category of seronegative spondyloarthropathy, meaning of the rheumatoid factors is absent. It is closely linked to the HLA-B27 genome abnormality, which is often present in more than 85% of cases. Uh, what is the etiology? It comes to etiology. The exact cause remains unknown, but the genetic plays a strong role. More than 85% of case of people ankylosing spondylosis are HLA-B27 positive. There is also a possible trigger from gram-negative bacteria like Calibacilla integrating its affect male much more than females, about a ratio of 10 is to 1, and it usually start in young adults. What is the pathology? Let's understand what happens inside the body. The disease starts from synovitis and inflammation of the joints. Gradually, this leads to destruction of the cartilage, formation of fibrous tissue, and later bony fusions called ankylosis. Even the spinal ligaments, especially the anterior longitudinal ligaments, undergoes the ossifications. It causes the ankylosing spondylosis. It comes because of its. It may be disturbing the range of motions of the axial skeletons. What is commonly affected to the joints? The first joints to be affected are sacroiliac joint. The condition they progress upwards through the spine. It may also affect hip and knee joint, the costosternal junction, sternum, and even the temporomandibular joint, which means of TM joints in the jaw. What is the clinical features when we're causing the ankylosing spondylosis? The exact clinical features is pain and stiffness. Other than the typical symptoms is dull lower back pain with morning stiffness. A key features is that this stiffness improves the exercise. When we do exercise, the stiffness may get improved. Patient may also experience the pain in the healing period. And in the pubic symphysis and costosternal junctions on joints. Something else we can modify it and you can tell it. Uh, then coming to the signs and symptoms, clinical signs of spine. Let's focus on the spine and the chest. The patient often have stiffness in the spine, which mention of stiff spine. With reduced mobility, chest expansion is significantly restricted, usually less than 5 centimeters due to costovertebral junction restriction. A classic visible of deformity of kyphosis or rounded hunchback posture. The deformity of the kyphosis and rounded hunchback shoulders may be get infused, while the sacroiliac joints get be affected and the ankylosing spondylosis may get restricted. Then coming to the sacroiliac joints and cervical spine. A sacroiliac involvement, we can use Clenson test or straight leg raise test or pump handle test. For the cervical spine stiffness, the Felchi test is a commonly used special test for the physiotherapist, which can we can test to the patient and we can confirm it rather than the test clinical laboratory test. Other than the clinical test, the other clinical features are some patient may develop a combination of synovitis and tenosynovitis. Other combination symptoms are ethno, ethysopathy, which is pain where the tendon insert into the bone, like it is called ankylosing tendon, plantar fascias, or ischial tuberosities. The pain comes under the way of ankylosing spondylosis. The pain may start from the pressure of Achilles tendon insertion to the bone. What are the extra articular features? The extra articular manifestation are ankylosing spondylosis doesn't just affect joints. It can also affect irritation of eyes, aortic regulations, and conditions abnormalities in the heart, spinal cord compressions, in the nervous system. Fibrosis in the lungs, which mimics a TB to the promotes it. Osteoporosis are rarely present. What are the radiological investigations? Radiological signs include sacroiliac joint erosions and sclerosis and the bamboo spine appearance. Blood test may be showed elevated ESR level, mild anemia, and positive of HLA-B27. The diagnosis supported if the patient is younger than 40, has an inducious onset, morning stiffness more than 3 months, and improve with ability activity. What are the differential diagnosis? The condition may I get a differential diagnosis are, uh, we must differentiate these conditions from tuberculosis of the spine, lumbar strain, disc prolapse, the osteoarthritis, a skeletal fluorosis. The differential diagnosis or signs and symptoms are the same as ankylosing spondylosis, because the differential diagnosis conditions are lumbar strains, which may affect both of cervical regions, lumbar regions, and thoracic regions may get infused and get affected. What are the treatment options which we can uh, uh, produce to the patients are, um, medical treatment includes NASIDs, DMARDs like TNF inhibitors like Entrocept, but physiotherapy is a key to maintain the functions of the body, which plays an important role in the ankylosing spondylosis patients and and their conditions to be improved their functions. When we come to the physiotherapy, the goals are postural correction, spine mobility improvement through the stretching and exercise, chest expansion exercise, maintaining their respiratory functions, the use of yoga, mobilization, and heat therapy to reduce the stiffness and pain for the patients, which may have improve their goals and regulations and improve their ADL activities too. When coming to the conclusions of this ankylosing spondylosis is a lifelong condition, but a early diagnosis and the consistent of physiotherapy can significantly improve the quality of life. Remember, as a physiotherapist, we are not just treating joints, but helping the patient to maintain their independence and their mobility too. That's all for the classes. Thank you for listening. Next, we can see about anything else, other conditions like differential diagnosis with anything else. Thank you.